Hi everybody. Today we'll focus on some reading skills to develop insight. Now when you have some text, what we expect you to understand is a bit of the background knowledge. So we'll cover one article today which will give you that, and we expect you to ask plenty of questions. This is to yourself as to how much you know about this article or about the message in the article. Keep a keen lookout on how to identify the author's purpose in writing the article. Then the main idea. So here I would emphasize that we will look at main idea per paragraph and not just the entire article. We will go passage by passage so you get to understand how to figure out the main idea. And of course, certain words we will highlight where the vocabulary is important. So let's begin. Today I would like to this is the article I would like to highlight. This article is from the India Today magazine and it's their cover story. So let's look at what the article is about. So the title of the article is quite clearly How Kerala Flattened the Curve. It's written by Jimoon Jacob, and this is about Kerala's healthcare system and how it's helped beat the COVID-19. So let's focus on this first paragraph. Now, the first line of this passage is a little bit descriptive, where the author is bringing emphasis on the Kerala Health Minister's state of mind. But what we need to remember is the name, because she has played an important role. So we have the patient zero. India's patient zero came from the three students from one of these um, places in Kerala. Okay, and this first paragraph is an introductory paragraph. The main theme here is only to bring our focus on patient zero. Now, patient zero, if you don't know, is the first person to contract the COVID-19 in any particular country. We've come to the second paragraph. Here we're looking at how Kerala is connected to the rest of the world, unlike a lot of other states of India, and this is because of the expatriate population. Now, expatriate population is nothing but a person who lives outside their native place. So, we have a lot of instance of Kerala citizens going out of state to work. This could include international uh, people also. The second paragraph gives us the information of the expatriate population, a person who lives outside their native place. Here we have 2.5 million people, and this is the number of passengers who come through the 4 international airports in Kerala. Now, this passage, the second paragraph, is again talking only about how the statistics are across the world. Now, coming to Kerala, It's managed to flatten the disease curve because it's lost only 3 people to the infection. That is the claim. Now, if you look at this graph here, we have the number of days passed after 100 cases, and Kerala features in the gray line, which seems to have brought down the numbers of infection compared to Maharashtra and Tamil Nadu and Delhi, of course. And here the author is also talking about the recovery rate of 84%. Just highlighting it this for you. The recovery rate is much higher than what it is for the rest of the country, which is only at 14%. For those of you who may be unclear about what overseas remittance is, it's the action of sending money in payment or as a gift. So typically, a lot of the population leaving Kerala would send back remittance over over Western Union, other money transfer agencies. Okay, so for the state, the major revenue streams are the remittance, the revenue from sale of alcohol, tourism, and sale of lottery tickets, all of which have come to a standstill now. And then the passage goes on to give us information about the revenue loss to the state, and the state finance minister. The name is mentioned and it's highlighted here, Dr. Thomas Isaac. Now we have the state's exemplary social indicators led to the coinage Kerala model in the 1970s. This basically, though being a low income state, it had high literacy rates and the citizens were known to be healthy and boasted a standard of living comparable to life in the developed nations. This is from the 1970s, where this term was coined, the Kerala model. So as to just emphasize that compared to all the other states in India, uh, Kerala did well in terms of standard of living. Now, presently, Kerala is top the country in overall health index. We have from low neonatal mortality rates, that is nothing but newborn deaths occurring within 28 days postpartum. That attributed to inadequate access to basic medical care during pregnancy and after delivery. Now, Kerala has the lowest neonatal mortality rates, and they have also the ratio of number of beds, hospital beds to people is much higher. So these two paragraphs are giving us a background information on why Kerala seemed to be more prepared than other states in India. Now here the author is talking about the fabled world-class healthcare systems that Kerala boasts of. So let's read that. I hope you have all read till lessons from this particular passage is setting the stage for what what follows in the article. Anticipating the pandemic. Now here we have some history of the Nipah virus given. Here the mortality rate was between 40 to 75% compared to just 3% in COVID-19. So here the author is drawing our attention to the preparedness of the state health machinery, which acted fast. And the same people were in power those days. This is the first time the WHO had praised Kerala, the second one being the recent most. Now, this paragraph here talks about two important things: the primary healthcare centers and the National Quality Assurance Standard accredited for government hospitals. These two are important. Now, here we have this paragraph starting with how the state of Kerala had identified four priorities. So, I would say kindly focus on this. We have four priorities here. They are checking community spread of the infection, insulating doctors, nurses, and paramedical staff, home quarantine of high risk category people to break the chain, and finally, putting the state under high surveillance against the infection. So, here we're going back to the reference given in the first paragraph about the three medical students from Wuhan. Now, let's look at something that the government did, which is an administrative step. They've put collectors as point persons in districts with magisterial powers. Now, we know that the maintenance of law and order is the principal duty of district collectors, right? Now, prior to independence, the DC, the district collector, acted both with judicial as well as magisterial powers, but that was removed after independence. Now, the judiciary is separate and the executive is separate. Now we come to an important point in this article, which is regarding the testing facility unit in Alappuzha district in Kerala. So as of now, the National Institute of Virology, Pune, tests all the samples sent. Now, Kerala government wanted a testing facility to be set up in their state. Here we are talking about helplines being set up at all districts and how the government appealed for everyone to self quarantine or home quarantine for 28 days. Contact tracing is nothing but people who have come in contact with other people. So once you trace that patient 0 met few others like 3, 4, and 5, you try and get in touch with them and see who else they met and so on. Okay, so that's uh, contact tracing is a word that's often used. We are here. At this point, we are halfway through the article. By now, we should know that the author is talking about the success of the Kerala model mainly because of the state machinery as well as the healthcare systems in place. Again, we're talking about the PPE, the personal protective equipment. And here comes the news about the NRI family from Italy that returned to the state without declaring that they had been to Italy. So, the second phase of the COVID-19 outbreak started off because of this family's negligence in reporting, and this paragraph talks about that. At this point, the state is talking about specialty hospitals for COVID-19 and corona care homes to quarantine passengers. So, this is something the state has done. They identified hostels and educational institutes and unoccupied buildings to set up the corona care centers for isolation. And they are 635 in number. So, this was done as early as, I believe, end of February, early March. The article we're referring to is written in late April. So, this is from early March. Now, here we have the mandatory isolation or home quarantine, what the period is. If it's 14 days, if he's coming from another state, and 28 days from outside India. So then we also come to another important juncture. Before the general lockdown was announced for the rest of India, Kerala state had announced one day prior, and they did it on March 23rd. It was a 21-day national lockdown that came into force after that point. The new paragraph is about social distancing. Kerala had advocated social distancing and use of masks as early as January 30th, and the schools were closed as early as March 10th. Though an appeal was made by the government to all religious groups to cancel community gathering, a lot of instances came up where we saw that they still had their gatherings. So on March 15th, the chief minister conveyed a video conference, and then he appealed to each community, the Christians, the Muslims, the Hindus, and all these leaders were, all these leaders agreed to go with the chief minister's recommendation. We have about one more page to go. Okay, so far you will have a fair idea of how Kerala did take certain steps in a timely manner. Okay, so let's also look at how the media was used by the government. So they launched Break the Chain campaign on March 15th, and they roped in some um, movie stars and popular actors for the campaign. The youth organizations as well as Kerala police got into this in promoting the campaign of Break the Chain. From an administration point of view, as early as Feb 18th, we have high-level committees and expert groups being created as early as 18th of February to work out um, recommendations that can be given to the government, that can be implemented, more importantly, to combat COVID-19. So then among the Expert committees, we have specialist doctors, virologists, disaster management experts, software professionals, and hospital administrators, some civil servants, as well as defense personnel. Looking at the effectiveness of how they use media, we have daily reports given by the chief minister. A dossier is nothing but a collection of documents about a particular event in this case. And here the chief minister would have his review meetings in front of the press. So we see a resurgence of the COVID-19 cases happening on the March of 27th of March in these two districts, Kasargod and Kannur, and then we have the single biggest spike. Now here, the final passage, the concluding passage, we've come there. Let's look at how this article is being concluded. So the importance of the volunteer force is being highlighted. So volunteer workers would also be standby ambulance drivers, nurses, and paramedical staff. Okay, and they would assist the 3,000 strong healthcare workforce. They would also help in delivering food packets to the poor or keep surveillance of those under home quarantine. And all this is completely volunteer. There's no payment. Here we have a few numbers, not really important from the exam point of view. This is only to give you some idea of the scale of the operations. Okay, so it's not really that important. You can glance through it. Now here the author is focusing on the possibility of the whole operation being successful should be attributed to the cooperation of the civil society and the state police force as well as the volunteers. That brings us to the end of this article. Here, the Chief Minister believes the next 4 weeks are critical. This article was written probably in the second week of April, published on the 27th of April in the India Today magazine. Now, reading such articles will help you, one, in terms of saving your time regarding, because the coronavirus pandemic has taken up so much of newspaper space that you will get lost trying to um, find relevant information, right? So typically in a college interview, like in a group discussion, or if there is a one-on-one interview, it's very likely the panel will ask you as to how one particular state has been able to fight this COVID-19, or what the Kerala model is and why is the rest of India wanting to implement the same, and so on. So this one article gives you lots of information to go by, and we have highlighted a few vocab words. I think I left out one. Complacency is very simple. It's a feeling of smugness or uncritical satisfaction with oneself or one's achievements. Here, complacency has no place in the Kerala model. 2.0 is how the author ends the article. The India Today magazine has covered coronavirus in depth, and it's important for us to understand what domestic steps were taken. So, in my next session, I think we will focus a little bit on implementation of the lockdown and so on. So, in this particular article, what I would highlight is probably the names of the Chief Minister, Pinarayi Vijayan, the Health Minister, KK Shailaja, yeah, and also how they have taken certain steps to reduce the infection rate, which is very important. Now, hopefully, you'll find time to go through this article. The magazine is available on the India Today website. It's called intoday.in, and you will find this there. Now we will do some supplementary reading on the Kerala model after a short break. Let's look at a newspaper article from the 29th of March. And this is also talking about how Kerala has handled the coronavirus crisis. Now, this is supplementary reading to our main article from the India Today magazine. This is from the Hindu, the newspaper. So here the first two paragraphs are talking about how the police, the Kerala police has helped people by buying groceries and so on, and helping people to stay quarantined at home. One of the most important aspects of the Kerala model, or the success of it, is the community kitchens, which has fed thousands. This was established during the Kerala floods, and now they have brought them back during the coronavirus crisis. What other states may be missing are the systems that are in place to regulate public movement, freight transport, and the movement of essential supplies. This is important to note. We have integrated disease surveillance program in the state of Kerala, right? And this has been in place since the Nipah virus in 2018. So we now focus on the past experience of fighting the Nipah virus. Here we're looking at the contact tracing exercise. Remember, we discussed this in the previous article, and this is how it works. So the second wave of infection has been talked about, and we have looked at this in the previous passage as well. The term patient clusters is nothing but when a number of patients are found in a particular area or even a household. So you would term them a cluster. So here we have the state government using ASHA workers. These are voluntary women organizations at the village level. and the Anganwadi, which is for pre uh, school children, and the Kudumasri workers is for women who are employed in small scale industries. Another interesting word from this passage is geofencing. For those who are unaware, it's simply a term used to demarcate certain localities. And today we call those localities hotspots, which are identified as places with high infection rate. Geofencing is a term used to describe how you would segregate these localities. So we have the Kerala model in action in this passage. Please read it. The Break the Chain campaign has been talked about. Two words I would like to highlight: contact tracing as well as war room. Contact tracing we have discussed. War room is simply a room that's designated as a nerve center of your action plan. So you would have all information pouring into that room and major decisions being taken in that room by relevant people. So here we are talking about the state secretariat is the place where the principal secretary and 5 senior IAS officers oversee its operations. Okay. So this paragraph talks about how the media was used effectively. Now let's look at, I think this is the end, the game changers, the last passage. Okay. So this passage talks about the healthcare sector and the positives. Okay. And here we have the negative, basically where the challenges lie for Kerala. So read this line, this should be self-explanatory. Comorbidity basically means diseases that can prove to be fatal in the long term. So you will hear of comorbidity in case of cardiovascular diseases, renal failure, the kidney disease, and so on. So the COVID-19, when is a major case for high comorbidity of the population. There's a final passage, sorry. The relief package of 20,000 crores is something the state government had announced, and where that relief will be sent is arrears due to contractors, loans, pensions, and so on. I hope you have all read this paragraph. Now, this brings us to the end of this passage taken from the Hindu. It's available online on the e-paper for the Hindu. We will continue with supplementary reading. I would like to discuss one more article before we close the session for today. This is the next supplementary reading. This is from the Indian Express newspaper, an article taken which talks about Kerala's district Kasargod, how it fought the coronavirus. This article is taken from the April 21st paper. And the national average of the doubling time is 7.5 days. Kerala has managed to extend it to a major time of 72. So then here we say we're looking at how the central government showcased the contact tracing and containment model of Kerala's Kasargod as one of the success stories of the containment exercise. Okay, so this could be a possible question. And here we have the answer by Showcase Kasargod. Remember in the India Today article, they mentioned 3 places in Kerala and they said patient zero was from one of those places. And here we know that place is Kasargod. So when you refer to multiple articles on the same subject, you will get more information rather than just stick to one particular article. Now let's look at the next question. How was this containment achieved? Take the time to read the passage. Now we come to the crux of the article. What is the Kasargod model? And then the article will go on to emphasize other models. But let's first look at the Kerala model. This passage talks about a common coordinated action plan, and the next passage talks about what that action plan is. Let's move on to the scale of the exercise. Again, a lot of numbers will be thrown at you. It's not important. It's simply to understand the scale. Having read this, you will now understand that one model will not fit everyone, right? What could work in Kerala probably may not work in Maharashtra. So what do we do? The centers asked district magistrates to draw up separate crisis plans for COVID-19 management, and they've shared several models. These include the Agra, Bilwara, Pathanamthitta, etc. So let's look at a few of these models. Let's look at the Agra model first. And when you read something like that, you must always compare and contrast. You must compare this with the Kerala model and also look for contrasting features. And similarly for the Bilwara model, let's read this quickly, please. So your takeaway here will be the hotspots from the Agra model and the ruthless containment from the Bilwara model. And the Pathanamthitta model is the Kerala model. Here we're looking at the community being involved. And that brings us to the end of this passage. Now, I hope these three passages have been of help to understand and decode the Kerala model. Thank you.